a senior citizen's mobile combined MRI and PET brain scanner for early detection of Alzheimer's, Parkinson's, and other dementias. We need your help. Funding is needed to finalize this mobile MRI PET geriatric resource through the FDA's safety and effectiveness process. When the FDA process is done, this mobile MRI PET scanner will be donated to a non-profit healthcare organization for imaging elderly people who have the genetic biomarker of Alzheimer's and Parkinson's diseases, as well as those people over 55 years old with type 2 diabetes. Ambitious goal is the early detection of Alzheimer's and Parkinson's disease for senior citizens to prevent or delay cognitive and physical disability. The ultimate goal is to be able to delay the onset of Alzheimer's dementia and Parkinson's disease by 5 to 15 years due to early detection and preventative treatments. It will become a reality with your financial help. Please invest. Donate $1,000. You or a person of your choice shall get a free MRI PET brain scan. For $2,000, you shall get 2 free brain scans, and so on. The medical reality is the MRI PET brain scanner can perform and quantify in vivo PET scans using a radio tracer that binds to the tau pathology characteristic of Alzheimer's disease. MRI PET scans will investigate changes in both amyloid and tau pathology in relation to memory change and the development of cognitive impairment. We can also identify possible protective factors which prevent or delay the onset of cognitive impairment in individuals who maintain normal cognition despite substantial Alzheimer's type of neuropathology measured by in vivo PET imaging. You can help get it there. The mobile scanner arrives at a senior citizen center for a day of imaging. This will be the first mobile 3 Tesla innovatively combined MRI PET brain scanner devoted to the benefit of senior citizens. This not-for-profit imaging program can significantly extend the healthy, active years of life and will also save national health care costs for senior citizens. Hopefully, the program will proliferate, with mobile systems expanding regionally to service all senior citizens' population centers. Your donation will provide the finalization of this first geriatric mobile MRI PET system through the FDA regulatory process. The following presentation describes how this is done. The FDA ODE, Office of Device Evaluation, is the regulatory agency for medical devices. Every medical device for human use must go through a regulatory process for safety and effectiveness. This includes the submission of an IDE to FDA, clinical trial, and a 510(k) submission to the FDA. An IDE is written and submitted to the FDA for an exemption allowing safety and effectiveness testing with human subjects using an investigational medical device. In order to obtain an IDE, the medical device must be designed and built following guidelines for good manufacturing practices. Its intended use must be defined. The manufacturer must do device safety testing. An investigational human clinical trial has to be planned with a scientific protocol for safety and effectiveness. Contained in the IDE submission to the FDA is information about the manufacturer with all the manufacturer's test results documented following UL and CE mechanical and electrical safety standards, such as pinch points and leakage currents. NEMA and IEC magnetic resonance energy exposure testing protocols and energy limitation standards for magnetic resonance devices are also tested and included. These energies include magnetic field, radio frequency deposition, and rate of change of magnetic field. Circuitry that ensures fail-safe energy limitations must be documented with descriptions and circuit drawings. Complete detail about the proposed human trial is documented. The FDA needs information about the site where the device will be operated, CVs of the medical and technical personnel involved, and their affiliations and function in the trial, including signed investigator agreements to follow the written protocol during the clinical testing. Subject selection methods and demographics will be described. The informed consent document that volunteer subjects will read and sign is included. If there is a university affiliation, a local IRB, that's the Investigational Review Board, their approval of the research trial should be included. The protocol involves criteria for evaluation of safety and effectiveness. All the information is submitted to the FDA in order to have authorization to begin human testing of the new investigational device. Once the human testing is complete, the next step is submission of a 510K to the FDA. This is the final submission of information that can result in the medical device being cleared for clinical use in the United States. The 510K submission includes summaries of the information provided in the IDE, plus the full results of the completed clinical trial. The FDA needs to review what the images look like, a statistical analysis of the protocol-defined results, and all comments and concerns acquired during the trial from both investigators and subjects. Copies of volunteer test subjects' signed informed consent documents are also submitted. Included are conclusions about safety and effectiveness. Labeling for the device, basically a short intended use statement, plus operators and service manuals are needed. Finally, there's a statement of intent to manufacture and market the device with copies of any marketing and advertising materials. I am the consultant to Wang NMR for obtaining and maintaining the regulatory compliance of this mobile 3 Tesla neurological magnetic resonance device. I've been a member of the Wang NMR's board of directors since 1988. I will develop and write both the IDE and the 510K for submission to the FDA, as well as assist in the protocols for the investigational human trial. I am the owner of a consulting firm, Medical Equipment Consulting, that handles regulatory affairs for radiology industry clients, university research clients, and government medical agencies. I am currently on retainer to the National Institutes of Health, NIH, in Bethesda, Maryland, and University of Minnesota's Center for Magnetic Resonance Research in Minneapolis, where I handle their FDA regulatory compliance for above 10 Tesla magnetic resonance imaging devices. By background, I'm a biomedical engineer with a neurology specialty. After college, I had a startup company, Physical Instruments Incorporated, designing and manufacturing brain blood flow monitoring devices. This included miniaturized devices for early astronauts to monitor their consciousness. I worked in the radiology device industry for 24 years, design, development, manufacturing, clinical research, and regulatory affairs. Most recently, I was an officer of Columbia University College of Physicians and Surgeons and the research administrator for radiology for 10 years. The timing to be able to use the mobile 3T brain MRI for senior citizens for Dr. Wang will be around 6 months, which includes development to submission of both the IDE and 510K, the investigational human trial, and FDA ODE's review times. When regulatory compliance is obtained, the system will be ready for utilization as intended.